All right, so just a brief thing about the EMT program. This would be our condensed version of our EMT Info Session. This form can be found online, and we can just type in Kapiolani Community College, or we can go ahead and do kapiolani.hawaii.edu. In our browser, you'll go ahead and look for emergency medical technician, and you'll scroll to the bottom. And in the bottom, we'll see forms and documentation here. So just go back to this overview of the program. Basically, it's going to tell us that we need some prerequisites, English Health 125, and you need to be placed into this math. An idea of what to take during those semesters would be kind of here and here. And the biology and math, this is for our EMS program altogether because what we want is somebody that's going to transition from EMT, which is the initial course, onto our paramedic programs, and I hope that all of you are geared towards that. And I congratulate you for deciding to enter this profession. We usually do these counselings both with our administrative staff, our faculty members and lecturers, as well as our instructors. And we also have our counselors to also assist in our providing information for these programs because in some cases our applicants may need additional resources and supportive services, which faculty, lecturers, and instructors and administrative staff may not be privy to. And that's where our counselors are very important to be here. A lot of application process is done online. And as you apply to the general registration to Kapilani Community College and then fill out our supplemental application, you'll find that these are some of the additional courses that you can take, and but this is um, the student fees that you'll also be looking at least for the EMT program. But as far as applying, there's the health and immunization record reconciliation that you'll be doing. So, info session and advising, I'm just going to talk about just preparing yourself for the EMT class. I'm not going to tell you about EMT or what the course is about. We're just trying to make sure that you are on the right path, that you have done the right things to apply, and then fill out the supplemental application for the EMT program. So we need these as the prerequisites. If you do not have these, then we'll have to work with a counselor to get you into the courses that we need you to get into. And if you are working on the additional requirements for additional EMS courses, then we'd still want you to kind of work with our counselors and keep in touch with our office here on Hawaii Island so that we can keep you on file and guide you in the path as we move forward. Then it's important to contact our counselors and contact our office as you apply because some courses, if they don't meet the requirements, you will be ineligible as this application would be then deemed incomplete. So we need to make sure that you complete all of those. You can take a compass test down here, and this can be scheduled and found online. Here, that URL kind of lights up. You can tell. We can click on that and take a look. Mat 103 placement is encouraged, but you take the additional mats as you move up through the pathway. This would be for our MICT program. Now, our advising is on Oahu here. So, what would have to happen is that you would contact them and potentially they could do this via some type of online web-based interview or uh, session, or they can contact you by phone or by email. But this is where we want you to look at. Again, as we look down the application, it's telling you if you're in Oahu, Maui. Let's particularly look at the Hawaii side. So you're going to be contacting us at this number and working with us to complete the application. attend one of these info sessions, and this is the a condensed version, trying to tell you that this is part of your steps, and we are there to answer any important questions as we move down towards this second step. And we want to then direct you into advising. So as you look at the application and you're looking at what you need to be accepted into our program, what's the next steps? What's your plan? How to get you there? We're here to advise you to seek our counselors, and they may also help with identifying additional support services and resources that you may require in order to be successful in this program. So if you need additional tutoring, they may be able to give us some type of resource. If you're a VA person, these guys would help us to identify what requirements that we may need to fulfill the VA portions. If we have holes or blocks or anything like that in our past, how to transfer credits, how to transfer from one college to the other. We're going to make these steps happen, and we're going to contact these additional advisors to help us in the process. We're going to need to have that CPR and first aid certification. We don't necessarily put on this class for individuals because we're very indebted in already in our EMS programs that it's very difficult for us to have a standalone course that's happening. But should we have enough applicants that require to have us to have a class, then we may offer this for that subset individual group. When we do have a CPR and first aid class, if you give us your name and contact information, we may be able to allow you to sit into those courses. Again, there's going to be a fee for that, and you'll have to sign up through our uh, continuing education portion at Kapiolani Community College. We'll send you a link should that occur or come up. In this box, we would like to default to our advising. But these are courses, additional courses that you can take to fulfill the degree requirement. And this degree requirement is once you pass or you get accepted into our EMT program, as you continue through the EMS programs, we'd like to see that you graduate from our MICT program and you would graduate the associate degree here. Now, if some of you already have an advanced degree or have an associate's degree, if you need a few courses to double major in something else, I mean, I think it's worth it to get the EMS associate degree at some point. This is only current up until 2019. As we're moving on to the subsequent years, please check the actual website for the tuition. But this will give you an idea. If you are trying to apply for scholarships or grants, such as, the Aululike or Kapiolani, or there's sometimes healthcare systems that will have these type of tuition assistance and tuition waivers or grants and scholarships. This will tell them, or this will you'll be able to give them some numbers as to how much it costs. Keep in mind, this does not include any type of travel that you will need to perform when we're on our clinical rotations. Okay, the EMT program is quite long. It's about 14 weeks long. The first 7 weeks include the National Registry content, which is about 180 hours. We did add in a 1 week clinical experience. This is to kind of give you an idea of what it's like to just be EMT basic, somebody that gets trained at the national level experience. It's quite condensed, it's very stressful. The material is fast paced, and we're going to need you to really time manage and learn how to learn a different system, learn in a different way. We do a lot of exercises and labs, we do a lot of scenarios, we do a lot of hands on portions, and we do have a lot of web enhanced material to help you along in the process, but you're going to need to do a lot of work and read the textbook and fill out a lot of these personal assignments that you'll be doing. As we transition from the EMT 110, we move into EMT 120. The EMT 120 is a 2 week course. It is a little longer only because it depends on what we're doing during that weeks. Sometimes we are still using it to clear students to get into the clinical setting, such as the hospital. We are also applying for the national registry at that time. But during the 120 is when we learn about all of the state level um, procedures and scope of practice for EMT to work in our ALS system in the state of Hawaii. This will include IV, EKG, 12 lead, some cardiology, and defibrillation. This does not include synchronized cardioversion, only manual defibrillation. As far as the 12 lead, is the application of placing on the 12 lead, and we'll be learning some simple, basic rhythms. We also go over during this time a pharmacology and formulary of the Hawaii State Standing Orders. This means that we want you to have a slightly increased working knowledge as a state EMT. We do not require you to memorize the mechanisms, the pharmacology, and such that you'll be applying it. But you need to know what it is and what we may use it for as you're assisting the ALS component and our ALS system. And we carry quite a few drugs, including narcotics. We also have additional skill sets that we also look to test and practice through. This would include an ALS airway assist, including ALS resuscitation. We also do a lifting and moving, as well as a vital signs skills test. Now, once we move past the EMT 120, we go into the EMT 125. This is our comprehensive clinical experience. This is where our EMT rotations continue on in the hospital setting as well as on our 911 ambulance providers. So we're going to be spending quite a few weeks out on the road and the clinical experience. We have to maintain our clinical acumen. We're going to have to do evaluations for every shift that we go on. We'll have case study requirements. We'll have skill sets that we have to maintain and capture. You'll be required to keep all of this documentation and information. It has to be submitted on the end of the course in order to verify that we've completed successfully the hours and the clinical rotation. Upon returning from the EMT 125 clinical experience, we usually bring you back in for about a week, maybe a little longer. During that time, we reconcile all paperwork for the entire program. Review to make sure that we have the documentation. We'll also have a final written exam for the state examination process, and we conduct a final skill testing, including all National Registry skill tests and skill set, including the Kapiolani Hawaii ALS skill sets for the emergency medical technician or EMT. Those skill tests have to be passed competently. You have 3 attempts at it. After the second failed attempt, the third attempt will be videotaped. A third attempt and a failure will mean that you fail out of the program. We hope this never happens, and we continue to practice. The written exam is online. It's also multiple choice. We need to pass this exam with 80% or better in order to pass this program. Upon completion of EMT 110, 120, and 125, we've already had you sign up for the National Registry application and your account there. Our program director, who is Jeff Zukernick at this time, will verify that you have completed this course. You will then see in your National Registry account as you check status of your application, it'll say that you are qualified now to take the written test and skills testing. The skill testings will have been done with us. So if you completed the skill set, you would have completed the skill set for the National Registry as well as the state. You will then have to schedule your own National Registry uh, computer-based test or CBT. That is again going to be scrutinized. You need to have forms of identification. You have to have a set time that you have created through Pearson View and the testing center, and you must follow their testing procedures. We will assist you with conducting or completing your um, National Registry and state licensure, as we will provide you with a course completion certificate from Kapilani Community College. This needs to be placed into your application for state licensure as well as the request from National Registry to be sent to the Department of Commerce and Consumer Affairs saying that you have completed both the written and the cognitive and the skill set or psychomotor skill testing. So again, you need to, it's a process in which we will go through, but that would be the end. Roughly, this is about 14 weeks long, and we're looking at about 340 to 360 hours because it's 180.5 hours of didactic, and then we're looking at 160 hours of clinical rotations. Okay, we'll field any questions at this time.